Hi and welcome back to another video of Medic Notes. This video is on anatomy of superior mesenteric artery. The superior mesenteric artery is a major artery of the abdomen. It arises from the abdominal aorta, and supplies arterial blood to the organs of the midgut, which spans from the major duodenal papilla of the duodenum, to the proximal 2/3 of the transverse colon. The superior mesenteric artery is the second of the three major anterior branches of the abdominal aorta. The other two are the celiac trunk and inferior mesenteric artery. It arises anteriorly from the abdominal aorta at the level of the L1 vertebrae, immediately inferior to the origin of the celiac trunk. After arising from the abdominal aorta, the superior mesenteric artery descends down the posterior aspect of the abdomen. At this point, it has several important anatomical relations. Anteriorly, the pyloric part of the stomach, splenic vein and neck of the pancreas. Posteriorly, left renal vein, uncinate process of the pancreas, and inferior part of the duodenum. The uncinate process hooks around the back of the superior mesenteric artery. The major branches of superior mesenteric artery. It gives rise to various branches that supply the small intestines, cecum, ascending and part of the transverse colon. The inferior pancreatico-duodenal artery is the first branch of the SMA. It forms anterior and posterior vessels, which anastomose with branches of the superior pancreatico-duodenal artery, derived from the celiac trunk. This network supplies the inferior region of the head of the pancreas, the uncinate process, and the duodenum. Other than that, the superior mesenteric artery also gives rise to numerous arteries that supply the jejunum and ileum. The arteries pass between the layers of the mesentery and form anastomotic arcades, from which smaller, straight arteries, known as the vasa recta, arise to supply the organs. The jejunal blood supply is characterized by a smaller number of arterial arcades, but longer vasa recta. In contrast, the ileal blood supply is marked by more arterial arcades with shorter vasa recta. Next, the right and middle colic arteries arise from the right side of the superior mesenteric artery to supply the colon. Middle colic artery supplies the transverse colon. Right colic artery supplies the ascending colon. The ileocolic artery is the final major branch of the superior mesenteric artery. It passes inferiorly and to the right, giving rise to branches to the ascending colon, appendix, cecum, and ileum. In cases of appendectomy, the appendicular artery is ligated. Let's look at the clinical relevance of the occlusion of the superior mesenteric artery. There are a number of causes of superior mesenteric artery occlusion, including thrombosis, embolism, abdominal aortic aneurysm, and aortic dissection. Often acute, occlusion of the SMA restricts blood flow to the midgut, resulting in intestinal ischemia. It is more common in the elderly, and most usually presents with abdominal pain. The most useful investigation in this scenario is CT scan of the abdomen. Treatment is surgical. This is a dissection image, showing the superior mesenteric artery and its branches. Here you can see the ileocolic, right colic, middle colic artery, the jejunal and ileal arteries, and the marginal artery. That's all for this video. Thank you.